Hello, everyone. Please allow me to reintroduce myself to you. I'm Dr. Jeff Gold, the Medical Director at Amsterdam. I'm here today to share with you a review of the infection control program we have instituted here in response to the COVID pandemic. We at Amsterdam are fully aware that the suspension of visitation for several months has caused a great deal of stress and worry for everyone involved. And because you can't be here to observe direct care for yourselves, we felt it was important for you to know what we've been doing to control COVID infection during this extraordinary pandemic. I would be remiss if I didn't mention these actions have been led by an interdisciplinary group of very talented people, including Florida Lucas, our infection preventionist, Bill Pascacello, our administrator, Gertrude de Guzman, Director of Nursing, Steve Katz of Purchasing, and Joe Elsick of Housekeeping. I'd also like to do a special call out to our very talented and dedicated nurse managers who somehow managed to create or modify COVID-only spaces seemingly on a moment's notice. And of course, we've had ongoing guidance from the Department of Health. First, you should know that we have adopted best practices and regulations that have been disseminated by the New York State and New York City Departments of Health and the Center for Disease Control. We have participated in webinars, Zoom meetings, and the like several times a week. We have scrupulously followed directives and modified our practices as recommended by these bodies. And finally, we underwent a Department of Health survey focused on infection control practice just last month. The feedback from the surveyor was positive. Many of the protocols that we have adopted here are routinely used during outbreaks of other communicable diseases, like for flu, for example. Other actions, on the other hand, are new to us, in fact, new to our industry, as we've been called upon to admit and care for COVID-positive patients admitted directly to us from the hospitals. I'd like to organize these infection control activities into a few important categories, all of course with the same goal of reducing the spread of coronavirus. First, education. Our staff was given refresher courses in infection control practices. You should know that infection control is a core competency of our mandatory annual training. However, under these extraordinary circumstances, we felt it was important that the staff understand how to employ recommended infection control. And it was very important to us to make sure that staff was comfortable working with PPE for droplet and airborne precautions. We reviewed best practices for hand hygiene, coughing etiquette, what we know about the coronavirus, for example, where it lives, how it is spread, and this information was updated and communicated to the staff as it evolved over time. Next, we established measures designed to create physical separation between the COVID positive and COVID suspected patient and the COVID negative patients who were not infected to our knowledge. Cohorting, or creating mini isolation units, was established. The goal was to reduce resident-to-resident contact and to reduce contamination by staff. Per our policy, family members or representatives were notified of these transfers. Third, we employed practices to prevent staff cross-contamination, inadvertent transmission of the virus from one space to another and from one resident to another. Probably most familiar to you using this technique is the use of PPE, personal protective equipment, used when providing care on the COVID positive units. And at the same time, PPE served the important function of protecting our heroic staff from getting infected themselves to the greatest extent possible. To secure PPE, we had procurement experts working 7 days a week to supply us with this heightened level of protective garb. And a good example of that are the N95 masks that we use for COVID protection. In addition, largely COVID-only teams were created to provide care within these mini units. Fourth, and extremely important, we underwent extensive cleaning and disinfection on a regular basis by our housekeeping staff. As you can imagine, this is no ordinary cleaning job. We made use of EPA-approved, hospital-grade disinfection to kill coronavirus on touch surfaces and on resident equipment. And in addition, an outside company has been brought in to provide deep cleaning on care units. Amsterdam was also compliant with guidance from the CDC and Department of Health on safe handling of linen, trash, and equipment. Fifth, as you know, visitation was suspended, while non-essential staff and volunteers were barred from entry. How did we take precautions to prevent the spread of COVID-positive patients coming from outside Amsterdam? This encompasses two groups. First, the Amsterdam residents who were COVID positive being readmitted, and second, this new group to us, COVID positive patients directly admitted to us from hospitals under mandate from the New York State Department of Health. From the moment they arrived, we made sure they had masks on while being transported. And as an extra safety precaution, we took the temperature of the patient before they went up to the floors. These patients were placed on the isolation units described above, and we used all of the above-mentioned isolation procedures on these patients. Sixth, from early in the pandemic, Amsterdam has been screening all essential staff on all shifts to identify possible COVID cases. This screening made use of a travel and symptom questionnaire as well as a temperature check. No one entered the building without this. There were no exceptions. And every staff was given a mask that was to be worn during all contact with residents. Again, there were no exceptions. And finally, throughout this period, a management team has met every weekday morning to review the status of residents, possible admissions that day, and supplies of PPE. We would review any new guidelines or directives from the relevant health authorities at that time. I hope that this review gives you a better sense of the broad range of efforts we're making to prevent the spread of COVID at Amsterdam. I know we're all tired from this, and everyone hopes it abates soon. And while statistics continue to improve, we know in the New York metro area, the epicenter in the United States, key COVID metrics are still too high to allow us to remove restrictions. On behalf of everyone at Amsterdam, I thank you for placing your confidence in us. We look forward to welcoming you back, and please stay safe and healthy.